Hey guys, this is Dr. Vidin from Physician Zen. I'm an emergency medicine physician working at an academic hospital, and I want to talk about emergency medicine as a possible career choice. If you're a pre-med or medical student and thinking about doing emergency medicine as a career, I'm hoping that some of the experiences I can share can help you decide whether emergency medicine might be a right fit for you or not. So I love emergency medicine, and actually when I was starting medical school, I thought I was going to do ophthalmology. And then I went into medical school and I quickly found that ophthalmology was not the right fit for me. And I switched multiple times my career choice from there. I thought I was going to do GI, maybe surgery, family medicine, med peds, or even anesthesia. And I didn't decide until really late in my fourth year of medical school. And I just wish I knew about emergency medicine a little bit earlier in my medical school career. And unfortunately, emergency medicine is not a required or core clerkship like family medicine, internal medicine, pediatrics. So you don't get exposure to emergency medicine a lot of times in schools until later in your medical school years. And at that time, it might be a little bit more difficult to get connections or get letters of recommendation. So I want to talk about emergency medicine now. So if you were really thinking about emergency medicine, then you should probably try to do shadow or do some rotations to get you more exposure to see if that might be a right fit for you. So let's start off about why I love emergency medicine and why I do emergency medicine. The reason I like it is because you're really the first doctor the patient sees when they come into the hospital. And you're seeing all different types of complaints from any type of background, whether they're pediatric patients, adult patients, OB patients. So the breadth of knowledge that you obtain from emergency medicine is very vast. So that's probably one of the best reasons I like emergency medicine, is just being able to see everybody and they're all undifferentiated, and it's really fun. The other thing I like about emergency medicine is the shift work. So I'm working 8 to 12-hour shifts depending on where I'm working at. And it's nice because you know when you start and when you finish, you sign out to the next oncoming provider and you're done. I mean, you still have to do charting and so forth, and you can still review the patients afterwards. But for the most part, when you're done, you're done. You don't take your work home with you at the end of the day. So one of the other amazing things about emergency medicine is doing procedures. So if you're really good with your hands, or you really like doing things, like physically doing things, emergency medicine is an awesome field because you're learning how to do advanced procedures, life-saving procedures, such as intubations, putting airways in, doing chest tubes, central lines, using the ultrasound for a lot of procedures as well. So there's a lot of procedures that you have to be able to do. And these procedures come in really handy because basically anybody that comes in, you have all the means and capabilities of potentially saving their life with the procedural skills that you have at the end of the day. The other thing that's also really nice about emergency medicine is the amount of subspecialties that you're able to go into afterwards. And I didn't know these things when I was going through med school, and definitely not when I was in pre-med. But after you finish emergency medicine, you can actually do fellowships in things such as pediatric emergency medicine, sports medicine, hyperbarics, critical care, ultrasound, toxicology, geriatrics, palliative. So there's actually a lot of options for emergency medicine subspecialists. And personally, I actually did 2 fellowships. I did a critical care fellowship as well as an ultrasound fellowship. So how I work, I actually work half-time in the emergency department and then half-time in the ICU as well. And I love it because it kind of gets me to change pace. So I work from everywhere from the urgent care all the way through to the emergency department, all the way to the ICU, which is the sickest of the sick patients. And also doing an ultrasound fellowship for me was great too, because I really love ultrasound, and it allowed me to do more research in ultrasound and get more exposure to teaching medical students and mentoring other physicians as well. Like any specialty, there can be cons to what specialty choice you choose, and emergency medicine is no different from that. So the biggest cons I see from emergency medicine is actually the schedule for me, is because now that I have kids, it's really unpredictable schedule. You get scheduled on weekends, holidays, overnight shifts. So it's hard to maintain a consistent schedule with your family if that's really important to you. That's sometimes really difficult to do. If you really like to see the same patients over and over again in the clinic setting, that you don't get that option in the emergency department. You kind of, whatever comes in, you have to see right away. The other con is consultants. So being an emergency medicine physician, you have to rely on your consultants a lot, which is actually awesome because they teach you a lot of things, but also sometimes you really have to fight for your patients, and sometimes consultants don't agree. So you have to really know your medicine really well, because sometimes you're actually advocating for your patient. Even though these are the specialists, you have to know your medicine well enough to present your point to a specialist and convince them that this patient needs a certain test or needs a consult or needs an admission. Overall, I love emergency medicine. I would not have changed my specialty choice even if I went back to this day. And if you feel like this is a fit for you, you should definitely look into shadowing opportunities to actually experience it earlier rather than later during your medical school career. Also, if you're interested in fellowships, like I did critical care and ultrasound, I think that's a really good avenue as well after emergency medicine residency, because it gives you a little bit more variety, and I feel like it actually increases your job longevity and potentially decreases burnout as well. And this is because you're changing the pace between the things that you're doing. So it's kind of hard to do the same thing over and over again every day, but if one day I'm in the ICU and then one day I'm in the emergency department, it's actually really nice to change that up as well. So I hope you liked this video. Please push the like button if you did. Please subscribe to the channel if you want more videos about certain specialties. I have a lot of friends that are from all types of specialties. So that's another thing that's really nice about emergency medicine, is you know all these other specialties. So if you want a video about why people like certain specialties and why they do what they do, please comment below for specific specialties you want to see. All right, thank you very much.